We are breaking into regular programming for a WCIA 3 special report. Governor Pritzker is giving his daily update on COVID-19 from Chicago. We're joining him now.
In addition to our IDPH Director, Dr. Ngaze Ezike, I'm here with our Illinois National Guard Director, Brigadier General Richard R. Neely, and Dr. Omar Latif, the CEO of Rush University Medical Center. During yesterday's public update, we focused on personal protective equipment, or PPE. Illinois' hospitals and nursing homes and first responders source and stock their own PPE, as does the city of Chicago due to its size. The state backs up all of these institutions, including the city and the entire state, in times of surge, which is why we're doing everything in our power to acquire massive sums of PPE from across the global supply chain to Illinois. PPE is only one part, although a critical part, of our multifaceted approach to tackling COVID-19. And today I want to talk to you about some of the important pieces of the puzzle that we've been working on. And I want to provide you with some of the data that's guiding my decision making. First, let's talk about testing capacity. Testing is important not only for an individual and their doctor so they can know how best to treat the symptoms that a patient is feeling, but also so that we as a state can understand the scale and severity of the outbreak across Illinois. There are Illinois counties with higher concentrations of COVID cases than others, and we also have counties with only a few documented positives where none of their surrounding counties have any positive cases. Testing helps demonstrate the actual reach of COVID-19 and informs us how we can potentially isolate the outbreak even as we work to flatten the curve. In the words of the Director General of the World Health Organization, you cannot fight the fire blindfolded. We cannot stop this pandemic if we don't know who's infected. Test, test, test. In February, we were among the first states to bring our own state laboratories online, providing us with critical early capacity. At the time, we were able to run around 50 tests per day. Today, we can do nearly 2,000 tests per day from all sources, with our state labs now running 600 tests per day in all three locations, Chicago, Springfield, and Carbondale. A lot of work has gone up into building up our testing capacity, and there's still a lot more work to be done. On Sunday and Monday, we began drive-through testing at 4 state and federal facilities. The Illinois National Guard opened our first entirely state-run drive-through testing facility in northwest Chicago, the Harwood Heights community-based testing site. This site is designed especially to collect specimens from our healthcare workers and first responders, and at current capacity, they can collect 250 specimens per day. Senior members of the U.S. Department of Health and Human Services were out to survey that site this last weekend, and they called our setup a national model that they hope to replicate in other states. I want to commend Brigadier General Rich Neely, our National Guard soldiers, and our teams at CMS, DPH, and IEMA for their exceptional work bringing this site online. Over the last few days, federal HHS has also set up sites in Bolingbrook, North Lake, and Joliet with private partners Walgreens and Walmart. These sites can run close to 100 tests per day as is, and up to 250 each with expanded staffing. Here in Illinois, our residents also have access to 4 commercial labs and 15 hospital labs that in total average about 1,500 tests per day on top of our state lab output. That's, of course, on top of the 600 per day that we run at our state labs. IDPH is working with some hospitals to stand up their own new labs, providing positive specimens to hospitals for validation so they can come online faster. As we speak, labs at places like North Shore Hospital and Southern Illinois University are expanding their capacity with additional equipment and supplies, with an expected additional capacity of 2,805 daily tests in 2 weeks. That will bring our in-state testing to more than 4,300 per day. Now, even with this rapid expansion, we still need tens of thousands more tests to get an accurate picture of our state. That's within our reach. Though standing up additional hospital lab sites will be required, and mobile testing sites will be required across the state, and we're doing that. And with a continued consistent delivery of necessary supplies, such as reagent and viral transport media, we can get this job done. Of course, nationally and here in Illinois, we are beyond the moment where testing alone can be our primary weapon against this virus. We can't just test. We have to treat. It's true that the vast majority of people will recover from COVID-19 on their own without hospitalization and without a specific therapy. But what we need to do is to ensure that our healthcare system can fully support and care for those who won't easily recover. One aspect of that is our healthcare workforce, those on the front lines fighting COVID-19 every day. And I'm very proud to say that since my call to action this weekend for those qualified to join the fight, we have had hundreds of nurses and doctors and other healthcare workers reach out to us and let us know that they are interested in helping. The application went live yesterday, and in just 24 hours, we've already received 180 applications from individuals ready and willing to rejoin the healthcare workforce. I encourage anybody who's interested to go to our coronavirus.illinois.gov website, and you'll be able to access the necessary forms for IDFPR to join our healthcare workforce. Another piece of this puzzle is our hospital infrastructure. Right now in Illinois, we have about 26,000 non-ICU beds, of which nearly 13,000 are currently available. We have nearly 2,600 adult ICU beds across the state, of which about 1,100 are currently available. Those numbers are fairly standard, but we know that they will not stay that way. I want to take a moment now to provide you with a fuller picture of what we could be dealing with in the near future. As I've said, you deserve honesty and transparency on the gravity of our situation and the reasoning behind the aggressive measures like the stay-at-home order that I've put in place. In our worst-case scenario projections, that is, without the stay-at-home order, in 1 week, we would need over 2,500 more non-ICU beds and 800 ICU beds than we have in existence in the entire state today. Further still, in 2 weeks, we would need over 28,000 additional non-ICU beds and over 9,400 additional ICU beds. That's untenable. The board next to me offers a moment-in-time snapshot of our current capacity and how these projections would stand up. As you can see, what we've seen in other countries of COVID-19's ability to overwhelm the system could happen here, too. We are not immune. But again, those are worst-case scenario projections with no interventions. Instead, what we've done already in Illinois is put in place a two-pronged approach to make sure a worst-case scenario does not become our reality. First, we've put in place protective measures to suppress the spread of COVID-19. That's our stay-at-home order, limits on gatherings, closing our schools, closing restaurants and bars, and social distancing guidelines. These are the steps that we've taken over the past 2 weeks to flatten the curve and prevent too rapid an increase in new cases. Second, we're working to increase our healthcare capacity overall statewide so that when we do arrive at our next phase, we will have the capacity to meet that much greater need. IEMA and DPH have taken a multifaceted approach to increasing capacity, building up our triage units at hospitals, bringing offline hospitals and hotels online, and expanding capacity in existing hospitals by acquiring critical equipment like ventilators to care for the most severe cases of COVID-19. IEMA has deployed 49 triage tents, 40 outside of Cook County, to set up triage units outside of hospitals to safely and efficiently evaluate potential COVID-19 patients. In total, 66 of our over 200 hospitals statewide have set up triage tents with IEMA or on their own. IEMA is currently working with 26 additional hospitals to set up triage centers. And my team and I will make sure that each and every one of those hospitals has what they need to get a triage center going. Rush University Medical Center has been a true leader in this work, and Rush CEO Dr. Latif will talk more about this approach in just a few moments. IDPH, IEMA, the Illinois National Guard, and the U.S. Army Corps of Engineers are in the process of investigating closed hospitals that could temporarily reopen to support our COVID-19 response. In a worst-case scenario surge, the state would turn existing hospitals into almost entirely COVID-19 response hospitals, moving non-COVID patients to other hospitals, including these re-outfitted locations. The number one difference between a standard bed and a COVID-equipped bed is a ventilator. Right now in Illinois, we have about 2,200 ventilators all across the state, of which 1,600 are currently available. In the worst-case scenario projections that I discussed earlier, we would need over 4,100 more ventilators to outfit our ICU beds within 2 weeks. Again, that's a projection based on no protective interventions. My team and I are pursuing every option to increase our state's supply of ventilators, including working with scientists and experts in Illinois and beyond to pursue innovative new equipment options. Yesterday, I spoke with President Trump to walk him through Illinois' immediate needs. Millions of N95 masks and hundreds of ventilators just in the near term. President Trump promised assistance, and yesterday afternoon, the White House notified us that we will be receiving 300 more ventilators and 300,000 N95 masks from FEMA in the coming days. On that call, I also urged the President to invoke the Defense Production Act. I know I sound like a broken record, but if I have to stand here every single day until I'm blue in the face and advocate that the federal government fully utilize this act, then I will. This is the reality. There is a finite supply of critical resources available around the world right now. There is an enormous supply of governors and countries trying to get those resources. We need the full might of the federal government to obtain and allocate things like ventilators and PPE. I know there are businesses out there right now working on turning production toward these critical needs, and I've been vocal about how grateful I am to the manufacturing community, for the most part, which is stepping up to try and help. But there is no way that these companies can ramp up fast enough to get us everything that we need in the time that we need it. Illinois had some of the earliest COVID-19 cases, and we were among the states with the highest number of positive cases, and we are still right now. We need to be a priority when it comes to ventilators and N95 masks especially. Of all the reasons that the federal government exists, this is the most important and the most basic. We are on a wartime footing right now, and we need an allocation of resources to the front lines that prioritizes where the battle is being waged most aggressively. I will continue to pound the table to get the federal government to acquire the supplies that our states so critically need and to allocate them accordingly. Lives depend upon it. The question that everyone wants answered right now is, how long is all of this going to last? The honest answer is, we don't yet know. I know that's hard to accept, but it's honest, and I'm determined to be honest with you above all else. The battle against this virus is a daily struggle, and our best minds and our bravest souls are suited up against it. I have tremendous faith in their ability to conquer it, but we have to give them the time and the space to do what they need to do. I want to be 100% clear about what will drive my decision-making in the weeks ahead. Science. I understand how difficult it is to see the economy slow down and watch friends and neighbors laid off from jobs. Those concerns keep me up at night, too. But I will say again, you can't have a livelihood without a life. As long as Americans still have breath in their lungs, we will find a way to survive and thrive. We can revive our economy. We can't revive the people that are lost to this virus. Finally, there has been some talk over the last 24 hours by some about who this nation might be willing to sacrifice to COVID-19 for the sake of our economic interests. Well, in case there's any doubt in your minds, I'm not willing to sacrifice anyone. There is no life in this state that is more or less precious than any other. No person more or less worthy of saving. I want grandparents around to help raise their grandchildren. I want people to spend years after this is over celebrating birthdays and wedding anniversaries and healthy retirements. I want Illinois to continue to be enriched by its young and old residents alike. Our economic strength comes from our diversity in this state and the hard-won experiences of our citizens. Without that, we are nothing. With it, there is nothing that we cannot overcome. And with that, I'd like to invite Dr. Ezike, our director of our Department of Public Health, to give you an update. Doctor.
Thank you, Governor Pritzker, and thank you for just affirming the value of each resident of Illinois. So we're all standing here trying to be physically distanced, trying to model the right behavior, and we're showing our support for the great leadership offered by Governor Pritzker. The members represented here and the people that you've seen at these daily press conferences demonstrate the interconnectedness of all the different sectors of our community. It takes all of us to counter this pandemic. The report for today is sobering, as it is every day. There are 250 additional cases, and there are 4 additional deaths. For Illinois, this brings our total of COVID-19 cases to 1,535, and unfortunately 16 total deaths. It is not easy to be reporting these numbers every day. And we won't fall into the trap of forgetting that these are people with families and friends who love them and people who are worried about them. And for those who have passed on, their loved ones are now grieving and don't have the opportunity to celebrate their lives with traditional funerals and wakes. Let's send our thoughts, our support, and our prayers to all of these families and their friends. This disease has affected every group in our society. It has affected people from ages 0 to 99. In terms of the data that we've collected, 54% of confirmed cases are white, 33% are black, 5% are categorized as Asian. We have 11% of Latino or Hispanic ethnicity. In terms of severity of illness, our data shows that 16% of COVID cases have resulted in hospitalization. 4% have resulted in ICU admission. Of the lives lost, we see that 92% of those lives lost were in those older than 60. So we see these sobering numbers, and we thank our governor for the aggressive steps that he has taken to try to reduce these stats. He's talking about all that is being done to increase hospital capacity so that we can care for all those that are suffering the most serious illness. And eventually decrease the overall number of deaths. Since January, the Illinois Department of Public Health has been working closely with hospitals in response to this pandemic, providing guidance on infection control, diagnosis, and leading the country as the first public health lab to be testing in-state. As the situation has evolved, we began holding weekly webinars with hospitals to provide the most up-to-date information and guidance, but also to hear what hospitals were seeing and what they needed. As information changed and we learned more about this novel coronavirus, we worked with hospitals on guidance for how to safely interact with patients who may be infected and when healthcare workers and staff should stay home. Just yesterday, we had issued additional guidance about screening protocols and triaging patients. Our hospital partners are invaluable, and we must ensure that they have the information as well as the resources that they need. This virus is causing hundreds of thousands of hospitalizations across the globe and thousands of deaths, and we need everyone to understand how severe the situation can be. Let's keep doing our part to help end this pandemic. Continue to stay home. Keep washing your hands. Stay away from hospitals and nursing homes. Let's do everything we can and prevent as many deaths as possible. Now I'll summarize my comments in Spanish. Todos estamos parados aquí tratando de estar socialmente distante y ser un ejemplo apoyando a los esfuerzos del gobernador. Nuestra intención es mostrarle que todos tenemos ser nuestras partes. Las noticias de hoy son que hay 250 casos y 4 muertes adicionales. En Illinois hay un total de 1,535 casos, incluyendo 16 muertes. No es fácil compartir esos números. También es fácil caer en la trampa de olvidar que estas personas tienen familias y amigos que los aman y están preocupadas por ellos. Sus familias están doliendo y no pueden participar en una reunión o celebración. Mandamos pensamientos, apoyo y oraciones a todas las familias y amigos. El gobernador habló sobre todo lo que se está haciendo para crecer la capacidad del hospital para atender a las personas más enfermas. Nuestros socios hospitalarios son invaluables y debemos asegurarnos que tengan la información y los recursos que necesitan. Este virus está causando cientos de miles de hospitalizaciones y miles de muertos en todo el mundo. Necesitamos que todos comprendan que grave es COVID-19. Recuerda, quédase en casa, lávese sus manos con frecuencia y no vayan al hospital o al asilo de ancianos. Cada día que luchamos contra este virus, nos acercamos a vivir días más normales. Contigo lo hacemos. And with that, I would like to turn it over to Brigadier General Richard Neely.
Good afternoon. Thank you, Governor Pritzker, for inviting me here today. Thank you for your incredible leadership during this extraordinary time, really unprecedented times here in the state of Illinois. I know you've had some very challenging decisions to make along the way and have made them. So thank you again for your leadership, sir.
Thank you, Jeff.
The Illinois National Guard is extremely proud to be part of the team combating the spread of COVID-19. And it's my honor to work closely with so many professionals across the state, local communities, and at the federal agencies. Of course, starting with my long-term friend, Alicia Tate-Nadeau, Director of the Illinois Emergency Management Agency, as well as Dr. Ezike for the Illinois Department of Public Health, each of whom have shown extraordinary professionalism and strength while addressing this unprecedented threat to public health. As the commander of the Illinois National Guard and the Adjutant General, I'm very proud of what the National Guard brings to the state. As I like to say, the National Guard is truly an American treasure. as we have two jobs, one for the Department of Defense and one to support the state as well as our communities that we live in. As a reserve for the United States Air Force and the United States Army, the National Guard is an extremely capable organization that's able to fight America's war, but also support our communities, states, when the governor calls. There is no other organization like it. In times like today, when the National Guard is activated, we tend to get a lot of attention. Men and women in uniforms like I'm wearing today, camouflage, large vehicles rolling down the street, draws a lot of attention. As citizen soldiers and airmen are called to duty, people that are your neighbors, your loved ones, your co-workers that live in your community, when they're activated, you hear about it. And they have been for COVID-19. As we discussed yesterday, and the governor's discussed several times at this podium in the last few days, the National Guard has been the subject of recent rumors that we were performing some type of policing action to enforce a quarantine. Well, let me repeat again today that the Illinois National Guard is not bringing weapons and not enforcing quarantines. What we are doing is bringing approximately 115 personnel of the medical profession, as the governor spoke of earlier, to support things like drive-through testing. We have physician assistants, doctors, nurses, as well as logistics support, folks that are out there on the front line helping our first responders, doing testing in our communities. We're looking at possible expansion once additional facilities have been identified by Illinois Department of Public Health as well as the Illinois Emergency Management Agency. We've also had a team that supported the expansion of possible hospitals, a team of individuals with engineering background, with specialties like electricians and plumbers and HVAC specialists, structural engineers, that went around and looked at recently shuttered hospitals that could be reopened, as the governor referred to earlier, as well as assessing possible hotels for expansion. Additionally, we're working closely with the Illinois Emergency Management as well as the Illinois Department of Public Health to support the distribution of the personal protective equipment, the PPE that we've discussed so many times. As the governor discussed yesterday, there is a lot of large shipment arriving this week. And so the Illinois National Guard is getting in position to support the other agencies to ensure the logistics for the delivery of this important PPE out to our first responders. They'll be repackaging and helping with the shipment, as well as working with the Illinois Department of Transportation. Our team is continually growing daily as we look for ways that we can continue to support the hospitals and the first responders who are really on the front lines of this response. We're here to support them. And today, not only do we have approximately 200 Illinois National Guardsmen and women engaged in this fight, we also have about 1,200 members deployed around the world defending our nation. As a part-time force, we are very busy. I'm so proud of the 13,000 dedicated men and women of the Illinois National Guard and proud of their willingness to protect communities, our state, and our nation. I'll be followed by Dr. Latif.
Thank you. This has been an incredible period in our history as a nation, state, city, and hospital community. I want to thank Governor Pritzker for his leadership and his willingness to take and make medical tough decisions. I want to thank the leadership of the city of Chicago for pulling people together to break down silos so that we can work as a city, the best city to face the challenges that we are facing. Chicago is a strong city, and all our hospitals are made up of amazing people. And they are working 24/7 around the clock, as long as it takes to help our community get through this. It has been 3 weeks since we formed a command center at our institution. Based on the recommendations of infectious disease experts from all over the world, we must learn from the experiences in other nations and cities so that we don't overwhelm our system and people that should not die because they don't have the resources that they need. There is no room for arrogance and hubris in healthcare, only humility to be taught from lessons learned from some great European cities. Like all of you, we hope that the intense mitigation and containment strategies are effective in decreasing the spread of this disease. Now is not the time to abandon the only measures we know will help protect us. These are to wash your hands, to shelter in place, and to practice social distancing. We are in a city where COVID-19 is actively spreading through our neighborhoods today. But even as we hope these measures will bend the curve of infection, a curve that by now you are all tired of looking at, Rush and our partners in healthcare in our community must be ready for a major surge of COVID-19. Chicago hospitals are coming together to take the lessons learned in both Seattle and New York to provide the best care we possibly can with whatever resources we have. We have spoken to iconic doctors and hospitals that are overwhelmed and listened carefully to what is happening so that we can be as prepared as we can possibly be. We all need materials to keep this going and protect our public and our staff. 3 limitations currently will exist in our ability to serve this community. Beds, as the governor has mentioned, and many conferences have shown the need for beds in our city. Supplies, we can have beds, but without personal protective equipment, it will be nearly impossible to take care of patients. Same with the ventilators that we desperately need. And staff. We have seen with this infection, staff getting sick themselves, and entire workforces being cut in half in a 2 or 1 day period. We have physically transformed our hospital to address these needs. We've expanded our emergency department. We've transformed entire units into COVID hospitals, like mini units that are designed to take care of patients, specifically with this disease. We've converted space that was never designed to take care of patients to hospital beds by putting up dividers. We've reassigned staff and pulled all hands on deck. We're taking advantage of anyone who reaches out to us that wants to help. We're using telemedicine appointments so patients can get the care they need without leaving their home. This includes hundreds of free video visits to those concerned they may have coronavirus, with instructions on staying at home or when to come in for testing. We've stopped elective surgeries before any mandate to prepare and save all the supplies that we have and to prepare our providers and give them time to get ready for this surge. And we did all of this to create greater capacity to care for critical patients who just about every international expert believes are coming. We believe it's coming, and as we prepare it as we possibly can, we still have limitations. Here's the truth. In just about every scenario in the future, the situation gets worse before it gets better for our city and for our community. So no matter how well we have prepared, we and all healthcare providers need help from our private and public partners to weather through this. To keep up the fight against this disease on our front lines, we need the supplies that we need. So we would ask for continued support of our state and local government, which have been incredible partners. With the commitment of the state and federal government, as well as private insurers and payers, Chicago will have the resources to continue this fight, and I firmly believe we will win. Medicine is a calling, and all those in healthcare have a mission to take care of everyone. And everyone who gets up and works in healthcare in every hospital in this city is facing this outbreak are heroes. I am honored to work alongside with them every day. I think I can speak for everyone in healthcare right now when I say that we know people are depending on us. As you are depending on us, we are depending on you. We are depending on you to remain in place, the shelter in place. We are depending on you to maintain a social distance, and we are mostly depending on you to wash your hands. Thank you, Mr. Governor, for your leadership. We firmly believe in healthcare. History will look back on these moments and recognize the sacrifices we made for the health of our population, of our community, of our entire city and our state. I now would like to welcome Governor back up to take questions.
Thank you, Dr. Lateef. Thank you. And just before I take questions, I just want to make sure everybody knows how hard we're working all across the state. We have 211 hospitals and we have health centers. We have so many facilities that we're working with directly outside of Cook County, outside of the collar counties, all the way down to the far southern reaches of our state. And we're working hard to work with your county health administrators, your public health directors, to make sure that you have the PPE, that you have the protection that you need in every county and at every one of these healthcare centers. And I'll continue to do that work. It's vitally important to me that we protect everybody in this state. We've had a larger outbreak, as many of you know, in Cook County and Chicago than in other areas of the state. But it is coming to every county. It's been now, I think we're in 26 counties, I think, so far. Are we at 31 counties. We have 102 counties. Just, 2 weeks ago or so, this was only in 1 or 2 counties. It is everywhere. No one is immune from this, and that's why it's so important to me that we protect people all across the state and that people abide by this stay at home and make sure that they're doing right by their neighbors and their friends. So with that, I'm happy to take any questions from members of the media that are in the room, and then we'll take some questions from those who are online.
And as the governor takes those questions, we'll bring you up to speed. There have been 16 coronavirus-related deaths in the state and more than 1,500 total confirmed cases in Illinois. The state is still working on getting more protective gear for medical professionals, as well as more ventilators and hospital beds ready. We will continue to bring you updates online at WCIA.com and on air during the WCIA 3 News at 5 and 6. We now return you to your regularly scheduled programming.